All right, so this next question was a comment on when I was saying, when I was commenting on the treatment intensity, like 120% of motor threshold and what have you. And this person is asking at minute 1:14 seconds, I said, in that video, we said it at 60. What does that dosage mean? Is that volts, millimeters, miles, etc.? So could you be more specific? Okay, I got you. And that speaks more to the previous question that we're talking about. So each machine has a magnetic stimulator. That magnetic stimulator has a maximum intensity for the power of that magnet. It's measured in Teslas, right? So it varies between 1.5 Tesla to 3 Teslas. There was a joke about that of like some patients talking about Teslas, as cars and what have you, in TMS and what have you. That's a different joke for a different time. But anyways, so that's the maximum intensity of that particular device, right? So when I have a patient and I'm doing mapping for them on the first session, and let's assume that this particular patient had an empty motor threshold of 50%. This 50% is 50% of the maximum intensity of this particular magnet, okay? Now I want to treat this patient, I will aim for 120% of their motor threshold. So that is 120% of 50%, so that would be 60%, right? So I set the machine at 60% for this particular patient. Hopefully that delivered the point. If that same patient, say I want to transfer my care to a different clinic, and they go to another clinic, that other clinic uses a different machine. Obviously it does use a different machine because I'm not going to transfer my machine to that other clinic. What I'm trying to say that even if it was inside my clinic, going from one MagStim chair to another exactly MagStim chair from the same manufacturer, I will still remap, because there is a life for that stimulator and for that particular coil. So the coil could over time not be able to deliver the same maximum intensity, right? So I want to use the same, I want to titrate the treatment for that particular patient on that particular chair. So I took the patient out of this chair, I put him on another chair, right? Now I'm mapping this patient on that other chair. And now let's say that their MT is 52% of the maximum intensity of that device, right? Now I set the treatment target at 120% of that 52. So that would be, I don't know, maybe 63, okay? All right. So hopefully that makes sense. All those numbers are percentage, okay? But we have to understand that when we're doing the MT, we're talking about the percentage of the maximum intensity of the coil, and then when we're setting the target, we're saying 120% of the motor threshold, measuring based on the maximum intensity of that particular machine, okay? All right, hopefully this answers your question. Disclaimer. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.